Hello everyone, this is Group 15 with Chloe Schlitt, Victoria Grant, and Daniela Lopez. Today we would like to tell you about the current state of home healthcare and some of the predictions for the future of home healthcare. We will also discuss the role of family members providing and who else is involved in home healthcare.
Home health care is the provision of professional services and care for patients with elderly status, disabilities, chronic illnesses, or medical complications within the home. These services allow an individual to remain in a comfortable environment while receiving all the assistance they need to live a functional lifestyle. The goal of home health care is to allow each patient the tools to live a more independent life and stray away from hospitalization when there is no need. Home health care services range from short-term companions to long-term daily nurses, aides in routine physical care for medical recovery. The type of care that an individual is provided is dependent on their condition status and type. Examples of services provided include supervision for elderly with dementia or Alzheimer's disease, grooming or bathing, ventilator care, feeding tube care, physical therapy, social work, and many, many more. This field is largely run by nurse/companion care, though some specialists in physical, occupational, and speech therapy do provide at-home services for those with more intense illnesses or medical problems. All matters of the individual, including health, once originated from the home. The importance of the family structure was commonly held, with the parental figures caring for the youth and all younger generations caring for the elderly. With the growth of specialized techniques and practices, doctors were more common in small towns. With such accessibility, members of the community were able to call on doctors to come to their home to assess their ill. Physicians often treated those with chronic illnesses and those in terminal care, while midwives were called to help with prenatal care and labor. In this way, many poor and financially burdened individuals were able to barter prices with the physicians and find health care that could be molded to every aspect of their situation. Nursing developed through the perceived religious obligations and social duties of young women. Through the words of Florence Nightingale, a pioneer in the field, nursing became a practical way to combat urban threats of disease and disorder. Services to the patient in the home was a strong effort to control illness spread and increase patient comfort.
Due to its catering towards those who have a deficiency that is best cared for from a comfortable environment and today's inevitably aging population, home health care has seen an increase in popularity and ultimately growth. The current model that home care agencies emphasize revolves around physician communication as it details exactly what the patient needs and how different health professionals can change their approach in order to best suit the patient. A physical therapist that goes to visit patient A and sees a complication that could potentially be cared for can report back to the nurse that's working with and focusing on patient A. Alternatively, if the nurse that works with patient A sees a mobility issue that's recently occurring, they can go ahead and contact the physical therapist so that their next visit is more centered not only towards general progress, but getting the patient the best health as possible. Communication between all the physicians as well as the family involved with the patient is vital to the best recovery. Home health care is also seeing a shift towards a more technologically inclined mode of treatment. Just like hospitals, larger home care organizations are trying to move towards electronic health records that patients and physicians are able to see and interact with. However, it has become a challenge for most smaller agencies with their lack of money available to pay for professional data analysis for interoperability.
A key factor to consider when predicting what the future of home health care will look like is the aging population in America. There is a huge number of Americans that are about to retire and rely more on Medicare and other kinds of government funding. Also, as we continue to make advancements in medical technology, people continue to live longer with chronic diseases. This means that there is about to be a huge growth in the demand for assistive care in the older population that will have diabetes, dementia, and basic functional mobility impairments. All of this adds up to an explosion in the demand for home health care services. More and more Americans will be in need of care that does not quite require inpatient level or even physician office level of care. This also means that there will be an even greater burden on the National Medicare Fund. This could drive down the overall amount of care that each person is required and qualified to receive because more services will be spread out over more people with the same amount of government funding. Overall, we can expect to see a large increase in the number of jobs in home healthcare services and an increase in the overall percentage of total healthcare services that home care will account for.
Home health agencies across the country all agree that forging a strong relationship with the family of the patient can prove to be beneficial. Knowing the family members and allowing them to be part of the process ensures that any progress made by physicians during home care is lasting. By explaining care routines and the nature of the work that a physician is doing on their loved one, family members are able to feel more included and can begin to further comprehend how one action can lead to the ultimate recovery or prevention of deterioration on the patient. They should be spoken to and taught what kind of medicine the patient should be taking, as well as the kinds of continuing care that should be administered whenever the physician is not there. Since most health agencies treat patients with chronic diseases or long-term conditions, many family-based caregivers are needing emotional support to help them cope with the load that comes with home care. Hospitals and outpatient clinics are currently finding ways to provide and offer the support for families that are caring for their loved one at home in order to increase morale and have them potentially lower readmission rates for hospitals. Without families helping a physician, the care of the patient and the progress they can make is largely inhibited, therefore making families one of the top priorities of home care nurses and therapists.
A major problem that arises in home health care is when patients are discharged from the hospital but are still not able to fully take care of themselves, so they hire home health care agencies to fill the gaps between their doctor's visits and hospital trips. One of the reasons this becomes an issue is because of the lack of communication between the home health care agency and the patient's primary care physician or hospital team. Medication lists are often not synchronized between the hospital and home nurses, so the patient might suffer from being on different medication routines. Another issue is in confusion over who is supposed to write and send out patient care orders. It's hard to get the hospital to take responsibility if they fail to send the patient home with orders. And it's also problematic when the home care provider has a different opinion from the primary care physician or head hospital physician about the best care routine for the patient. All of these miscommunications can lead to rehospitalizations and can drive up the cost of healthcare and the recovery time for the patient.
The increase of popularity with home healthcare does bring certain implications to surrounding hospitals. However, most prove beneficial to both the care of the individual and the business of healthcare institutions. The biggest effect home healthcare has on hospitals is that it dramatically reduces the rate of readmission within 30 days of being discharged. Reducing this rate of readmission has proven to be cost-effective and is also a promising alternative to receiving readmission penalties from Medicare. For this reason, more and more hospitals are endorsing home healthcare and are turning to it as a very good option for long-term care. In fact, more hospitals today are looking to partner with home care agencies. While it does dramatically improve hospital statistics and does a great job of helping patients recover or get the extra help they need at home healthcare is facing some difficulties in reimbursements. Though it is a generally growing field, large insurance companies like Medicare have had reimbursements for this field cut by the federal government. Instead, more third-party insurances like Aetna are helping these agencies and the physicians that work with them.
Home health care may be right for you for a number of reasons. You may need additional care after leaving the hospital following a major surgery and may need help with wound dressing and pain management. Home health care is usually for the older population that doesn't have any other source of assistance in their lives and may involve help with medications, cooking, cleaning, housekeeping, dressing, bathing, and eating. It can also include physical therapy and occupational therapy visits to people with recovery from chronic diseases or surgical injuries. Home health care can be a great source of peace of mind for a family that has jobs and can't be there to help with their loved ones all the time. Home health care can also be right for you if you require a level of care that is just below that of a physician's office or hospital. It can be a great cost saver for you and your insurance company to avoid expensive visits to emergency rooms. You should talk to your physician if you think you need additional help at home or want to transition from the hospital to your own home.
And now for some discussion questions. 1. With an aging U.S. population, how do you think home health will affect younger generations' home life and job prospects? And 2. What advances in home health care could be made to increase patient independence?